Hi, I'm Claire. Welcome to Your Dental Besties.
And I'm Ben, and today we are going to be keeping it real, talking all about how to get that pay rise.
The bit we want to know, how to make money.
That's the bit everyone's going to tune in for.
Yeah, like this is going to be the one that's going to get the most like subscribe. You told me how to get a pay raise, but before we go into that, I put out on my Instagram, as you know I like to do, what is people's favourite dental word? I'll tell you mine if you tell me yours.
Favourite dental word? I do. It's not necessarily one word, but I love cusp of Carabelli.
Ooh, that was a popular choice. Do you have a cusp of Carabelli?
No.
No, I do.
I don't. Do you?
Only special people have them.
Well, apparently they're more common than not.
Oh, thanks. So common. Underhanded, little dig there.
Yeah, no, I don't have one. I wish I did.
I think they're a plaque retentive factor, so
Take them off.
just get rid. They don't want them. You don't want a cusp of
yours?
Carabelli. Huh?
What's your favourite dental word?
My favourite dental word, mamelons.
Oh, I like a mamelon.
I like a mamelon. It just sounds so wrong, doesn't it?
Mamelon.
You've got some great mamelons.
Mamelon.
I actually, after this, got, so I put out what my favourite dental word was, and then the amount of people that got in touch and was non-dental people, they were like, what the heck is a mamelon? So then
What is a mamelon?
Yeah, so then I put out what do you think a mamelon is? Without Googling, what do you think a mamelon is? And some of the stuff that came back was hilarious. I think,
what?
Obviously everyone thought they were tits. Tits give a lot. Boobies. People were like, oh, is it somewhere you go, but you bring your mum along? That came along.
Your mum along.
Bring your mum along. And then someone said something, and it was a really good play on words, and I did not write it down. It'll come to me as we're talking about something else, and I'll interject oh my God, I remember. But it was words of a song, and it was almost like Mamelon.
Yeah, is it a Shaggy song?
Yes, someone said something that Shaggy didn't do or something. Yeah. Oh, hang on. So tell me about why is that? Because I read that and I don't get it. So something that Shaggy didn't do.
I'll play it in the car on the way home.
Oh, okay. Does it come up the word?
No, but you could change the word that does come up.
Okay.
With mamelons.
We take up far too much time on the rubbish stuff. And
Maybe we'll put it on the Insta.
Yeah.
Should we sing it on the way home?
Okay, yeah.
Okay, we'll put it on the car on the way home. We'll put it on our Instagram.
Road trip.
Yeah.
Okay, so some of the words that our colleagues said were their favourite. Some were a bit boring, like maxilla, linea alba. Tenacious. I feel so studious when I write it in my notes.
Tenacious.
I do like a tenacious.
Yeah.
Tenacious calc.
Yeah.
Quite a few people said that mamelons also make them feel very naughty. Spin barket is one I didn't think about.
What?
Spin barket.
Spin barket? Why am I just hearing this for the first time?
Have you never heard a spin barket?
No.
You've never heard a spin barket?
What is spin barket?
People are in their cars now either you've never heard of it, or they're going to be what is
on earth is spin barket?
I mean, I feel like I'm like...
Is it just you with your Leeds accent, or is it...
Okay, spin. Barket.
Barket.
I'm trying to sound posh.
Spin
okay, so you know when you're really, really dehydrated and your saliva goes sticky, gloopy
That's what
saliva?
it is.
Well, I think so. I'm worried that I've made this up now. Well, whoever
Is
it
that
is,
after
also,
a night out, you have that horrible...
crusty lips. No, but
Spin
barket's I'm going to have to research this afterwards because I've either made myself look extremely knowledgeable or thick as anything.
Right. We're putting a poll on who knows what spin barket is.
That is going to go on after this podcast. Okay,
Yeah.
Let's see. Are you in the right or am I in the right?
I don't know. I've never heard of it.
Actinosetima... I can never say
No,
this one.
AA. Let's be real.
Let's just get AA.
Yeah.
AA. Can you say it?
Actinomyceta comitans.
Actinomycetima comitans. Do you remember when it used to be Actinomyces actinomycetima comitans?
Yeah.
Oh, I liked it more. I can say that easier. That's harder.
I'm
I can
not sure
say
if you
easier.
can.
Actinomyces actinomycetima comitans. Is that not right?
I don't know. It doesn't sound right.
I'm making myself look so silly. Someone said alveolar because it reminds them of I can't say this word. Do you remember that garlic dip? Aioli.
Aioli.
Is that how you say it?
Yeah.
Oh, we need to stop this feature because we're making ourselves look thin.
Alveolar.
Alveolar.
I'm still liking cusp of Carabelli.
Oh, I've got a good one. Moist.
No, I hate that word.
So they actually wrote this. I can't say it to patients because if I reference it to patients, I say, keep your tissues and they couldn't write it. They were like, they were saying basically, they're like, moist.
No. I don't know why. Everyone hates that word.
Moist.
Yeah.
Why, do you like it?
No, I hate it.
Moist. I say to patients like, So bacteria like that warm, moist environment. I say it quite easily, actually. I'll say, like Invisalign, it's a warm, moist environment. It's like a biofilm hazard. Okay, so that's the first feature done. We've got used to now, like, not spending 35 minutes on that first feature. So let's jump straight into it. Let me ask you the question. How would you approach pay rise? One thing I will say is you do not go up to a business person and say, can I have more of your money?
No.
No.
That's never good. And I think people get set back a lot because they're like, I want a pay rise. And then the dentists, obviously as business owners, are like, well, okay, but how are we going to give you that pay rise? There's only so much pie to go around, isn't there? You've got a slice and you want a bit more of the slice, but the pie needs to get a bit bigger. Again, we talked about it on the last episode. We are our own business. And if we want to increase our own revenue, we need to think of ways that we can propose that to business owners.
Propose solutions, not problems.
That's it, yeah.
Going to an owner and saying, I would like a pay rise is a problem for the owner. Now he has a hygienist who wants more money or a therapist who wants more money. Going with a proposal of how the solution to make more money, you're going to be definitely, the conversation is different.
Yeah.
It's a much
100%.
nicer conversation.
And I think going in there, being open and then also hearing from their side, business things is always obviously a bonus. I think a starting point will certainly be market research. So what are other practices in your area charging?
Yeah. Do yourself a SWOT analysis.
Yeah. I mean, when I first started in clinic, we were charging £69.50 for 30 minutes, but everywhere else was maybe charging £45.50. So we're already more expensive.
Yeah.
But then it's, okay, well, that's the fee. That's what the business needs to survive. I want the business to survive because I want a job and I love working here.
Yeah.
But what am I going to do that's different to hygienist A or B down the road? So it's just little things, yeah? And my boss is so good, but she always likens it to, like, you go to a hotel. You go to a cheap hotel, you get your room, it's clean, it's pleasant, that's what you're there for, you leave.
Yeah.
You go to an expensive hotel, it's the patient journey, and I think that's so important. It's the reception standing up and greeting you.
Yeah.
Good afternoon, Claire. Would you like to take a seat? Could I get you a tea, a coffee, a water while you wait? The smell.
Yeah.
So that's a big thing in our practice. We don't like the dental smell.
Yeah.
And then me personally, always going to collect the patient. I
same.
always go get the patient. Good afternoon, come on through, have a chat with them. It's they're buying into us and the business as a product.
Yeah.
They're not buying into a PMPR or a scale and polish or whatever you want to call it. I think changing that mindset makes the patient a little bit happier to pay for a service. I've had a few patients that had left and then come back and said, I went somewhere else because it was cheaper, I'm going to be honest, but I just didn't feel like they cared about me.
Yeah.
And it's, I mean, we've discussed it and we're all guilty of it, but we give like 110% in every appointment. My cup is empty at the end of the day because I've given it all away throughout the day, but I want that patient. It's a lot of money. I don't know what £150, because that's what we charge now, means to each patient. But if they're willing to invest that money in me and the product, the company, then they deserve the very, very best all the time. Some people might have scrimped and saved for 6 months to save up that much money to put aside to then have a hygiene appointment. So I'm going to give them 110%.
Yeah, definitely. I think an easy way for pay rises without asking for one as well is percentages.
No, percentage, absolutely, all the time.
And
if you're self-employed, you should be on a percentage, though.
Yeah.
I don't understand how an hourly rate works if you're self-employed.
Yeah, because it definitely feels more of an employed status, that, doesn't it? If it's
I don't know. And again, we're our own business. Self-employed, there's risk involved.
Yeah. If you're not treating patients, the risk is you not getting paid. So there's the risk.
I tell you what else we hear all the time. So I'm currently on 40%. I want more percentage. The percentage is a big thing because I've worked in places where I got 30%, but the patient fees were really high.
Yeah.
And I've worked in places where I got a bit more of a percentage, but the patient's fees were much lower. So what is the percentage actually of?
Yeah.
Because when you work that out...
50% of nothing is nothing.
Exactly. Yeah, or 30% of £200 is a lot more money.
Yeah. Yeah. There's that. And I think that's so implementing what you just said a second ago about sort of seeing it as a journey, and then what can I do in that appointment to make it more valuable compared to someone down the street that's charging a lot less. And if I can then up how much I'm charging based on what I'm bringing, like, am I doing blood pressure checks? Am I introducing HbA1c checks? Am I, all these different things that you can add
having
value?
a conversation about the menopause.
Yeah.
Even as simple as, so we in practice, the little Q-tips, like you clean babies' ears and noses with, yeah? We got those, we cut them in half, and then, do you know, like before you disclose, it drives me mad when I have a cotton wool roll and a bit of Vaseline just off the big tub that's like petroleum jelly, it's not even Vaseline, blobbed on the side.
Yeah.
No, I want the cotton tip, and I want the posh, I call it the posh Vaseline, or a bit of vitamin E oil.
Yeah, I was going to say vitamin E oil. Yeah.
I'm just going to apply this. Yeah. It's going to stop the disclosing solution going onto your tissues, so you don't have purple lips, but it's also going to nourish the lips throughout the treatment, because I'm going to be pulling around. That simple thing might cost you 7 pence per patient, but I can guarantee hygienist A, hygienist B down the road, it's probably not doing that.
What about even creating something and actually saying you're doing it to nourish the lips? So it's not even that it's part of like the disclosing. You're doing a lip massage. Yeah. I'm just going to do your lip massage now. No one's doing lip massage.
No, it's nourishing the tissues, because we do pull them round.
And it's something that, we're pulling them around, and it's part of the mouth, and it's a tissue that's external. So let's make them look nice. Do you know what? Again, my mind, I'm like, no, I really want to do some sort of lip something.
But simple things.
Like my own lip oil. Create a flipping lip oil.
Right. Lip oil.
I need to not talk about business ideas on the podcast. People are going to be doing this.
We're talking about pay rises.
Pay rises. Well, there you go, though. There's your pay rise. Create your own lip oil business.
So I think it's little things like that. Like, what can you bring to a practice that they've never had before? They might never get again. What is your USP? What makes you so unique that practice needs to part with a little bit more cash and then give a bit more to you to really keep you there?
Yeah.
And
what can you bring that can mean that you charge more than the practice down the street? So if you want a percentage, there you go. There's a pay rise there. And then the other thing as well is the language. So this was a really big thing for me. When I went to the practice I've just left, I went there wanting to increase their prices quite dramatically. So I think something they were charging like £80, I wanted to charge 150, and they were like, that patients just won't pay that. That's just ludicrous. And I said, well, the risk is on me, because if I'm sat there with no patients, then you have a surgery space. I think they had space for like 2 days a month. Yeah. So I was like, I'll take that, foot in the door. And then I was like, but let me talk to you about how I want you to speak about my appointment. We're not going to call it skin and polish. We're not going to call it S&P. It's no longer that treatment. It's oral health optimization. So we're going to change the language. By changing the language, we change the narrative. The narrative is it's a health treatment. It's a journey. It's education. It's getting you to optimal health, and then it's maintaining optimal health. It's about talking about systemic health. It's about doing blood pressure checks. It's a health treatment. It's no longer just a standalone scale and polish to remove tartar or calculus. I can't believe I just said the word tartar to my colleagues.
Tartar's a salt.
Tartar. It's not about removing calculus. And so we changed the language. So I became an oral health expert. Don't call me a hygienist. I'm an oral health expert. So when the referring dentists are talking about me, I'm an expert, which means that the patient doesn't have any preconceived ideas about what I'm going to deliver. If they've seen a hygienist in the past, they're thinking scale and polish. So if they're seeing the expert for oral health optimization, that doesn't sound like anything they've had before. So that changed the narrative of what I'm delivering. Obviously, like we just spoke about, I'm delivering more. So there's a blood pressure check involved, like da-da-da-da. And then the sort of, if the value is right, the cost is immaterial. So then no one questioned £150, even though they had a hygienist there that was working on less, doing traditional modalities. I obviously came in bringing a different treatment modality, stuff that I invested in myself, because I was like, this is how I do my treatment. It's slightly different. I'm going to bring, this, that, and the other. And then, we grew. And then from there, it was like within no time, you're sort of working 4 or 5 days a week, because all the dentists are like, my mindset's different. It's in their mindset was different. I see this as a different treatment modality now. I know this isn't just a scale and polish. Before the composite bonding, I want to send all my patients to C-Clair. Before they have their implant, I want my patients to be optimized in C-Clair. And then their mindset changed. The patient's mindset changed. If I'm honest, my mindset changed. I valued myself so much more after that. I went in as a business person. I came out going, I am high value. And then we upped the prices slightly again. And I reckon I could probably do it again, because I feel like when it's perio, maybe I should be charging even more again. I haven't done that because I think I'm reasonable at the prices that I'm at. But there you go. I went from working at a practice before that, earning a lot less, to then, and I created my own pay rise by offering something slightly different.
It goes back to communication. And basically, I agree with everything that you said. I think just to simplify it even further, and listeners, I'm really not that obsessed with car washes, but if you go to a garage, okay, and you want a Hairy Monster car wash, yeah, there's the basic bronze, gold, platinum, yeah. No one I know would ever go for a platinum because you don't really know what you get an extra, okay? You just want the car cleaned.
Yeah.
And it's the same thing in practice, yeah? But if you openly communicate that with the patient, if you went into the garage and they were like, you can have a bronze, it's £8, or we can wax everything, we'll clean your wheels, we'll clean under the car. It's a much more kind of thorough clean, more comprehensive. It's only an extra £7. You'd be like, well, I'll just get that then. Yeah, because you know what you're paying for.
Yeah.
And that needs to start with reception. When the new patients call, it needs to be transitioned into surgery. Yeah. It needs to be that this is something that's really, really important to manage for life. Yeah. If you want to keep your teeth, you need it.
100%. Another interesting sort of point that you've kind of alluded to there is the language from the reception, I think, is imperative.
Reception are key.
They are so important. They are so important. So the language in the practice, the narrative in the practice, the mindset shift in the practice, but then the other thing, don't talk about time. Because if a patient knows they're paying blah, blah, blah for 20 minutes, blah, blah, blah for 30 minutes, blah, blah, blah for 45 minutes, what about if you started just sort of changing the timings? If the patient doesn't know the timings, you could be charging the same, but it's maybe, you know, for maintenance. You know what I mean? Like if they know everything, then you've got it, there's a transparent. Not that we're not hiding things from the patients, but say for example, you were like, we pay £150 first time you see a patient, a patient, and then you sort of squeeze things a little bit. Do you know what I mean? There's little ways of changing things there. But the patient, if you're talking about H2, I call it H2. So H2 would be 20 minutes, H3 is 30 minutes, H4 is 45, and H6 is 60. And I work off that code so that because obviously the reception needs to know
roughly how much.
Yeah, but you don't want the timing to be said to the patient.
Yeah, completely agree.
A patient also pays me for a treatment, not for a time. Yeah. So if it takes me 5 minutes to do the appointment, it costs £100. If it took me 30 minutes to do the appointment, it costs me £100. It's a treatment they're getting, not a time with me. The incentive is the healthier they are, the less time they have to have treatment because, you know, and it's not that I did used to have a H2. I don't work with 20-minute appointments anymore because all it takes is a patient to be late or a patient
that's your day's ruined.
I got caught out. It used to be my superstar patients that had H2s. And I got caught out one time when a patient hadn't seen me for a long time, but because she was so good before, she was on H2 and then they put her into H2. But a lot of things had happened. Not to go into it too much, but OH-wise, massively gone downhill. It was no longer a H2 situation. And then you're having to have that conversation, like I have to now charge you more because it's going to be a longer appointment. So to evade all of that, it's a H3 minimum now with me. So that's kind of how I work. And H3 is like maintenance. That's like well maintained. But having the conversation about time stops you from being able to sort of move things around time-wise. So there is a little bit of play around there if they don't know exactly how long the bums are meant to be in the seats.
I think it's definitely having confidence to approach it. I think it's having solutions armed. Might be solutions that you've seen. I mean, it must be really hard to be a principal. Like you're a dentist doing your job and you're in surgery and trying to manage the practice. And
let's face it, a lot of them haven't actually been trained to do all of those things. I mean, dentistry, hopefully. But they're like, everyone's walking around winging it.
I do sympathise for practice owners, but take it to them. Look, I can develop this. I know I can create a hygiene department that's kind of profitable and functional and that patients will really appreciate, and as will you. Let me run with it, yeah?
Let's create a plan.
Yeah.
And let's review it every month, every 3 months, and see where it's going and adjust accordingly.
Yeah, I'll take on the responsibility, but I'm going to need a bigger cut.
Yeah, to be taking on the responsibility, it takes it. So go in with, I want more, why? Well, but go in and saying, do you know what? We could grow this into something that's, and I'll happily do that. I've got these plans. Look, these are my plans. This is my proposal. Can I get an extra 10% to be able to do that? And then we'll see it grow. We'll keep monitoring it and see how it's going. Or if we hit this target,
then
can I have it? Do you know what, interestingly, we have a colleague, we both know, I won't name names. She used to have a bonus. So she could reach a certain target in a month. She'd get, I think it was like £1,000. Like, she must have been rolling in it. It was London, let's be fair. But let's not, let's take away the fact it was London. It doesn't have to be £1,000 bonus. If you hit, in 3 months, if you can hit this target, then you could have, I mean, I'm not a big fan of KPIs, but that's another thing.
I think there's like ethical things, because then you've got to make sure you're doing it for the right reasons and things. But I do think, I mean, we're opposite ends of the spectrum. The previous podcast we were talking about, no room, it's so busy. And now we're talking about growing a diary and asking for a pay rise.
There are going to be people out there who are starting from a diary that is gappy. And there are people where it's too busy.
I think it's, at the minute, it's extremes.
Yeah.
So like, either you're really, really busy, something's going really, really well for you, but you need to find space somewhere, or it's really, really quiet. And if you think of it, the commonality is probably how it's being communicated and sold to the patient.
100%. So I've got someone that contacted me recently, and they said that they're working for a new corporate, or it must have been taken over by a corporate, and the corporate were putting the prices up quite a lot, and they felt like, you know, it's hard to justify these price increases. So my book's getting gappy because of the fact that the prices are going up so much. And I guess from that, if you're going to up the prices, you can't, it's very difficult to up the prices and nothing change. You can't have the same and pay more for the same.
But there's price elasticity. There's going to be a point where people think it's just too expensive and I can't afford it. We're living in a time where everyone's very money conscious at the minute. Everything's super expensive. And you can't have a standard. I think corporates are maybe a little bit more guilty of this than independents, but you can't have a standard. All hygiene appointments are going to be £80 because in London, Oxford, £80 is really cheap.
Yeah.
If you go up north, like where I'm from, £80 is a lot of money. Like if you're in some village in Northumberland, £80 is an awful lot of money.
Yeah.
And it's what is important to that patient.
But if the value to the appointment is different, to the people charging less.
What are you doing different? Why am I paying more for it?
Yes, exactly. And I think that's what patients, they'd be happy to pay for it if if the value is there, the cost is immaterial. And
but
so
being sensitive about it as well. Like, I've been to some practices where they'll just increase the fee and the patients come out and they're like, well,
what changed?
why is it so much more money?
Everyone expects £1 or £2 as inflation, but
being kind of courteous about it, emailing them, look, we've invested in X, Y, and Z. Therefore, we're going to increase your appointments, but this is what we're going to do, and this is how it's going to be different. This is why it's more beneficial. Letting the patients know beforehand and giving them a choice.
Yeah.
That's what it's about. It always comes back to the patient.
And it always comes back to communication.
Yeah.
Yeah, I totally agree. I think that's it. So let's just summarise then. Let's quickly summarise because we've just done a lot of gabbing. To summarise, you need the value. So what are you doing different? What can you do differently?
What is your unique selling point, your USP? What is your USP?
What's your USP? Go with solutions, not problems.
Yeah.
So if you're asking your boss for a pay rise, remember you're asking it's a business owner.
Yeah.
So go with a solution. Don't just go with the problem of I want more money.
Yeah.
And business proposal. See yourself if you're self-employed, see yourself as a business, and that's empowering in itself.
Yeah.
I like that. It's empowering.
You work for yourself.
Yeah. And then go with do you know what I actually have heard people say though, just to digress? I have seen on the forum people say, well, you're a business, just tell them your fees have gone up. What do you think about that? That's a difficult one to navigate. If you haven't given them that.
I suppose you can, but put yourself in their shoes. If you just go in and the practice owner could come into you and be like, you're self-employed, I take a cut for rent of the surgery whilst you're working.
Your rent's gone up.
Your rent's gone up.
Yeah, you are playing with fire with that one.
I think it's not a nice... Yeah. Yes, there might be your boss or there might be your principal, but it is a relationship. I call my... in my practice, my work family. They're the ones that I see more than my own family. Like, I love my boss. I would never want to do that to her, but it's respect for one another.
Yeah. Yeah, no, it is. And I think if your relationship at the beginning wasn't that way inclined, like if you went in there as a business owner and it was very much like, I'm business, your business, we work together, and you were like, oh, sorry to let you know this, but like, I've had to make a business decision and I'm going to be, just to give you a bit of bit of warning that in the next blah, blah, blah months, I'm going to be having to increase by £1 an hour, or if you're paid on an hourly, or my percentage has gone up 5%, 2%, 1%, whatever, I don't know what you do, then that's a different conversation because they're prepared maybe for it, because it's how your relationship is. But I think if you're like having a almost employed relationship where you work for them, and then all of a sudden you're like, and now I'm going to change things and I'm putting my percentages up.
It's a very difficult conversation to have.
That's probably going to create a difficult dynamic. Yeah, I wouldn't advise that.
Do rent surgeries off.
Yeah, don't approach it that way.
Yeah. Do not listen to your. Yeah, no, it's very difficult. It's very sensitive, and it's bespoke to each practice and the patient's needs.
Yeah.
There's so many variables in it, and it's hard to just say like this is what you need to do. Again, like the purpose of the podcast, we are your dental besties. We're giving our opinions now, but and I'm sure you are more than happy to chat with someone who's got maybe like more specific circumstances that want to kind of talk through it.
Yeah. Like if this is hitting nerve, reach out. Yeah. If this is hitting nerve and you're like, I want to elaborate on that.
Yeah.
Or, reach out.
Well, this is my problem. How do you kind of propose to come around it?
Yeah.
Yeah, definitely.
Another one, interesting, just on a similar thing before we go on to agony aunt and agony uncle. Ethical prophesization, in the sense that biofilm, there is a business in biofilm. So another way potentially of not necessarily asking for a pay rise, because that's kind of what we were talking about, but another way of maybe increasing ethical prophesization is looking at your recalls. So we get so fixated on 3 and 6. How have we not spoken about
I'm obsessed with recalls. Can we have a whole podcast on recalls?
Let's do a whole one.
I'm obsessed with recalls. It's to do, again, bespoke care.
Yes.
It's to do with the inflammatory response. I still, obviously there's an evidence base for it.
Yeah.
But if someone's inflammatory kind of switch turns on at 9 weeks, just because the guidelines
says
3 months, I'm not going to make them wait an extra 3 weeks just to get an appointment.
If someone is not getting stabilized on a 3 monthly recall, I'm dropping them down to 2 monthly. Yeah, exactly. See if that works.
It's important, I think. We have some fantastic guidelines in the UK. They're evidence-based, highest level of evidence, really clear to follow. But I think it's important to remember the guidelines and not policy.
Yeah.
So they're there to guide us. But again, each patient's an individual. No one's the same. You might have someone who's going through the menopause. You might have someone who's going through a divorce. You might have someone who's just given birth. Like, everyone's different. And I love the thing that you say, you tell them what they need, not what they want. So they might be used to seeing someone 6 months, but actually now that's not appropriate for you. And I changed my recalls. So my recalls are on weeks now.
Yep.
Just because it makes it so much more clearer and it's bespoke. Like, okay, you're not going to be able to see the dentist when you see the hygienist, but hard tissues will deteriorate slower than soft tissues, so I really want to keep on top of it.
Yeah.
And I just think it's so important, and I don't think it's spoken about enough.
Yeah, I totally agree. And before we move on to agony aunt, agony uncle, just to tell you sort of something that I've brought in after my NSPT. So I'll do my round of NSPT, again, bespoke. So I do my step 1. I've seen the patient for their first health appointment or health optimization appointment. I then tell them about the disease, treatment plan, go through it all, and they go, okay, NSPT. So we have like 1, 2, 3 appointments, whatever it is for the course. And then I do a review now at 6 weeks. Yeah. Now, I'm not going subgingival at 6 weeks. We're not doing anything. So
we're disrupting the biofilm.
We're disrupting the biofilm at 6 weeks. So then I've just put in another recall. Now, again, it's not to make money out of a patient. It never is that. Never to make money. But I want to disrupt the biofilm to get them best results at the 12 week, and just to make sure they're on the right path and that they're not deteriorating.
12 weeks is a long time.
It is a long time.
They think, I've had the treatment, I'm done.
Yeah.
No, actually, 6 weeks check-ins, really good. Yeah.
Yeah. Ethical prophesization, I call it, because you're not doing it for anything other than the patient's best interest. It just so happens as a byproduct of that, it could be good for, the hygiene team to grow to having a different mindset about what you're delivering and how you're delivering it, and not just being like fixated on this 3, 6.
We're in a good profession. Biofilm's always going to form.
Yeah.
It's our job to disrupt it and help the patient get rid of it.
Within minutes of it accumulating, biofilm re-establishes onto the tooth surface. Okay, it's not pathogenic at that point. It's the early colonizers, but they're despite their best efforts, and it's not that we don't trust our patients, we teach them very well, but there are so many nooks and crannies they cannot access.
We can't see. It's hard.
Yeah, exactly. So they need us. Okay, agony aunt, agony uncle.
Okay, right, I'm ready for this one.
Okay. let's not do a really, really long one because I feel like we don't shut up. Okay, that's kind of like it's actually what we've already alluded to. So should we just roll with it because we've kind of already spoken about it?
Let's go with that.
So, am I missing something with recalls? Can anyone?
Yes,
Yes,
you are.
We just told you. Can anyone advise where I can find 4 of 12 recommendations? I've only ever seen 3 of 12 and 6 of 12 until recently, and I don't want to say the wrong thing if 4 of 12 isn't appropriate for certain patients. Do you say 4 of 12 anytime?
No, it's not. You can't just group someone in 4 months, 6 months, 3 months.
Yeah.
You can't do it. You use them as benchmarks. So we'll use 12 weeks, and we'll use 16 weeks, and I don't know what it is. 26.
Yeah.
Yeah, for 6 months. But if you've got to set thresholds, and I think this is really important. So you've got to take your bleeding scores, you've got to take your plaque scores. Otherwise, how's the patient going to know? These things are tangible. They're setting a goal. This is what I need you to get towards. If you've got someone with 50% bleeding score and they're coming in every 6 months, we'll say, I'll use months so everyone can follow, then that's not working. Yeah. So, okay, 26 weeks isn't working for you. So let's see you at 20 weeks next time.
Yeah.
Yeah. Come in, okay, you've worked really hard, your bleeding score's now dropped to 30%. It's still not right. It might be that you're susceptible. Have a little look at your medical history. Is anything kind of alluding to it?
Talk about menopause.
Yeah, talk about menopause, talk about stress, talk about sleep, talk about all of these things. Okay, let's go with 12 weeks. I'm going to drop it right down. I just want to see where you're at. And this comes back to your ethical
Profitization.
Yeah, that's it. Because you aren't selling, you're just telling the patient what they need.
Yeah.
It's their decision whether they come or not.
Yeah.
But it's really, really important that we all start kind of being a lot more fluid with our recalls.
I always say to my patients, based on your assessment,
Yeah,
because I
based
think
on your
patients think
assessment.
we're just like, because they always hear 3-6, 3-6.
Yeah.
It's like our opinion, and patients are skeptical. So having this tangible, like, bits of information, percentages,
Because you're asking
based
them
on
to
assessment.
part with the cash.
And based on your assessment, I don't want to leave you blah 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 weeks because based on my my assessment, you're too high risk. Or blah.
Yeah.
And then it's not your opinion; it's based on tangible evidence that I've looked at in your assessment, and so it's not justifying. Because the justification is that it's about everywhere there. The justification is that you need it. But yeah, remembering patients are skeptical, so they need to know this information.
I had a patient the other day, and we were seeing each other every 12 weeks, and then it had been 26 weeks since I last saw them. Okay, there was a lot more bleeding, a lot more inflammation, and I had the bleeding scores and the plaque scores for all of those appointments previous. So I sat down in front of the computer and I was like, look, this is where you were. These were your bleeding scores. These were your plaque scores when we're seeing you every 12 weeks. Look at the difference when we see you every 26 weeks. And she was like, oh, I really think I need to come in every 12 weeks then. She's like, is that all right with you? And I was like, absolutely. Like,
so it's almost that she made the choice based on the evidence.
She made the choice.
Yeah.
Because you've shown them. But this kind of not disclosing, not taking bleeding scores, I wouldn't have a clue if someone said, you've got a bit of bleeding there, you've got a bit of gingivitis. I mean, what is a bit of gingivitis?
Yeah.
You've got disease or you haven't. A plaque score, you just need to focus more on the left. I'm like, well, that means nothing to me. Where on the left? What do I need to do more?
Yeah.
It's time, it's communication.
Yeah.
Again, communication's a big thing because we're so pressed and we're so conditioned.
Yeah.
Patients pay for treatment, so we do treatment.
Yes.
And it's not about that. Treatment is your analysis. Treatment is your 6-point pocket charts.
Yes.
It's your conversations. It's your clinical photos. It's all of these things. If you can manage to do intraoral treatment within that, then brilliant.
Yeah.
But if not, then you need more time or the recall needs to be shortened.
Yeah. So just to summarise, it might be 4 or 12, it might be 3 or 12, it might be 6 or 12, it might be 1 or 12. It's bespoke and it's based on your assessment. It might be 12 or 12. Oh, I never go that far.
Oh, no, that makes sense.
Yeah, I was like,
I said it. But, you
Don't
know,
go too far.
Yeah,
Yeah.
it's a need.
Yeah.
And all we're doing is taking data, we're analysing it, and we're giving them a solution and a product to buy into.
Yeah.
Therefore, you're going to get your kind of increase in salary. You're going to make high turnover for the practice. And your patients are going to be healthy.
Yeah.
Like, who doesn't want healthy patients with more money?
Yeah. Yeah. I think we can sum that up there. I think that was a fantastic little episode. So if you liked this episode, make sure you remember to like, subscribe, comment, send
Share
us messages, and also send us in your messages of what you want us to talk about. If you have a burning question, if you want to be featured on Agony Aunt and Agony Uncle, or if you've just got something funny to tell us, because we like the funnies.
We do like the funnies.
So yeah.
Thanks for listening. Bye.